Inflammatory diseases of the oral cavity are of major interest to chronic disease prevention because of their high prevalence in the population and chronic character. Oral diseases may start in childhood and, if untreated, may persist throughout lifespan, therefore exerting adverse effects on the whole body over decades. Chronic inflammatory processes have moved into the spotlight of current research due to increased awareness of their modulating effects on various systemic diseases, such as cardiovascular disease. By modulating, I mean that biological processes are, for example, intensified and therefore result in an earlier start or more severe course of a systemic disease. Gingivitis and periodontitis are chronic inflammatory diseases of the oral cavity. They affect the tooth-supporting tissues in response to the accumulation of bacteria. Constantly forming bacterial deposits on the teeth cause a chronic inflammatory response with many stages, ranging from reversible, low-level inflammatory gingivitis to irreversible, higher-level inflammatory periodontitis. If periodontitis is left untreated, it will lead to tooth loss. The prevalence of moderate to severe periodontitis in Western populations is approximately 50%, whereas the prevalence of gingivitis is up to 62 to 94%. Approximately 12 million Australians suffer from periodontitis and bleeding gums, and in remote areas, nearly all Aboriginals and Torres Strait Islanders have gum disease. Chronic systemic inflammation has been linked to cardiovascular disease, diabetes, low birth weight, rheumatoid arthritis, and dementia. The mechanisms are not fully understood, but the release of bacteria and inflammatory mediators from inflamed oral tissues into the bloodstream has been documented as a potential pathway. For example, oral bacteria have been detected in atherosclerotic plaques, where they may contribute to faster development of plaque in the arteries, increasing risk of cardiovascular disease. A multitude of epidemiological studies in the field of cardiology, diabetes, or adverse pregnancy outcomes have shown that periodontitis is an independent risk factor for chronic diseases. Those who suffer from periodontitis are twice as likely to experience myocardial infarction or a heart attack compared to the same person without periodontitis. Having periodontitis makes a mother 1.4 times more likely to have a baby with a low birth weight. On the other hand, the risk of acquiring periodontitis is approximately 5 times higher among diabetic patients compared to non-diabetic patients. Importantly, these associations have been demonstrated in several interventional trials to have a causal relationship. Further investigations, including associations and mechanisms between diet, obesity, cognitive impairment, sleep disorders, or cancer and oral health, are needed. The current body of evidence shows oral health significantly contributing to health in general. Oral disease prevention and therapy may also contribute to whole body health. Therefore, it is vital to raise community awareness of the interactions between poor oral health and chronic diseases.